Okay, fantastic. So good afternoon, good evening, good morning, everyone, depending on where you are zooming in. I saw on the call, we have people there from the US, with a lady called Lydia and many others. I saw some people from the UK. Today is promising to be an international session. So I welcome you all to this session. This is a session that we do every Sunday. Where we just meet and we talk about matters health, how we can live a longer, healthier life. And today we are especially privileged because we have a gentleman who is going to talk to us about a topic that affects all of us because we all have our skeletal structure. And as you're going to learn, as you grow older, you might get into trouble with your skeletal structure. Unless you look at a few things. And the gentleman that is going to talk to us is a medic. He's actually in the medical profession. And he's somebody who is well-versed in the wellness field. He's been with us for quite some time, but also happens to be a medic. So without further ado, I'm going to welcome Bona Riphath Simba. Simba, karibu.
Thank you. Thank you, Fred. Can you hear me?
Yes, I can hear you.
Okay. Just want to go straight to the topic today, bone and joint health. I've been trying to work with my computer, but it's letting me down because of technology, but I could work with my phone. To the viewers, my name is Riphath Simba. I am a biomedical scientist by training. And I joined the opportunity while I was an intern at Kenyatta National Hospital. And what motivated me to join is the challenges the department I was basically an intern. I saw people having challenges, more so the blood. And through interrogation with my registrar, I found that sometimes when we leave conditions to get into our bodies and become chronic, getting them out becomes a challenge. But today I'm going to talk about bone and joint health. It's a challenge. It's a challenge which is affecting both the young and the old. And basically, it becomes chronic as we age. And I will start the presentation by saying that the skeleton, that's where this is the part of the body which carries the weight, which carries the muscles, which carries an individual, which makes an individual to move up and down. That is not well fed, is highly neglected. And because of the neglection and because it's used daily, it has a slow progression of challenges. Now, what am I talking about? I'm talking about the muscles. I'm talking about the joints. I'm talking about the bones. Those are the areas I'm going to focus on in my presentation. Now, any movement one makes, any movement, any speech, any digestion in the body, it involves movement of muscles. Sometimes I joke and I tell people that in the stomach, there's a lot of muscle movement. And through the muscle movement, there's mixture of food and the digestion takes place. We don't have a spade in the stomach to mix the food which we take. So it's the movement of muscles. And because of that, there are basic minerals which are daily used, or the body utilizes to perform its physiological functions effectively. One of it is calcium. Another one is magnesium. There are others, but let me just focus on the two because it's the depletion of the two which makes now one to need more minerals. Now, you can make one to deplete the calcium levels. Now, where do we get calcium levels? As we grow, when we are suckling our mother's breasts, that's the major source of calcium levels. Sometimes I ask people, what do we get from the milk? Or from the mother when the child suckles the mother? What does the child get? And the people say it's milk. But nutritionally, what do we get? It's calcium. That's why 6 months down the line, the child does not consume anything, but by consuming the mother's milk, the child is able to add weight. That means the muscles increase, the bones increase, and the other functions, other organs develop because of the sensitivity of the calcium and other minerals. But the macro mineral is calcium. Now, together with that one, as we grow, we are supposed to constantly supply our bodies with calcium. From where? From the food we eat. And one of the major sources of calcium, we call them chia seeds. We call them the broccoli, the hormones, to some extent milk, more so for the children. This one is highly debatable because I usually tell people that milk has calcium, but it's good for the children, not for the grown-ups. Now, I've just highlighted some sources of calcium. Suppose you get the calcium levels through the diet. What kind of lifestyle which can lead to depression of also this calcium? Also, eating badly, diets can deplete calcium. What do I mean? If you eat a lot of meat, meat is acidic in nature. And if you want to prove that one, just look at how the cats, the cat family, that start living with the dogs. The dogs were made to eat out of meat. And there's high acid to digest it. That's why if you see the defecation of the dogs on the grass, it burns the grass because of the high acid levels. So meat depletes calcium, more so nyama choma. Soda depletes calcium, more so Coke. That acid levels, when you open it, that acid levels, when you take it and there's belching, that's a balancing, that's acid-base balance the body is trying to get. And getting the acid-base balance, it withdraws calcium from where it's stored to balance to bring the pH balance in the stomach. Yes, all milk is also not good for the bones. As much as it contains calcium, sometimes the fat part of it depletes calcium because it's acidic in nature also. Look at the cream which is gotten from the milk, and it forms the cheese and the butter. That's the kind of thing I'm talking about. That thing is acidic, and if it gets into our bodies, it increases the acid levels. And once it increases the acid levels, then the body has to look for the pH balance. And by doing so, it withdraws calcium to dilute the acid. So that's one way of depleting calcium in our bodies. Another way is overworking. If we overwork our bodies, that means the muscles are moving up on this contraction and relaxation and contraction of muscles all the time, like runners. That means the muscles are going to consume out of calcium. For those who have our mothers and grandmothers at home, you can see they are working in the chambers for the whole day. If you imagine now holding the chamber and pacing up and down, digging the whole day, that's a lot of muscle relaxation and contraction, and it leads to calcium depletion. Even sitting in an office, typing the whole day, in a saloon, trying to weave the hair, anything which involves muscle movement the whole day, working in a restaurant, moving up and down, being a teacher, talking up and since morning till the evening, writing on the board, whenever an activity which involves stress on the muscles, it leads to depletion of calcium. There's a debate about overweight. Overweight, it doesn't necessarily deplete calcium, but it depletes the cartilage. I'm coming talk about it. Other conditions, there are those people who are having some disease conditions like ulcers or acidic levels in the stomach. It depletes calcium because once the acid levels are high in the stomach, it means the body has to look for the pH balance naturally. And by doing so, it draws calcium from wherever it's stored nearby. And that's where people who are having ulcers, chronic ulcers, they are having severe lower backbone pain because they have affected, the acid is affected the cartilage there. Also, those who are working in some chemical industries, there's some chemicals, more so the paint industry, which now, when those chemicals, they are breathed in, they combine, they draw calcium. The molecules combine with calcium, and now they deny the body calcium. So you find that people who are working in the chemical industry, some chemical industries, most of the paint industry, or even the industry which involves the painting, sometimes they develop some bone challenges because of that. And those also who drink a lot of water which contains fluoride. Fluoride combines with calcium to make fluoride to make a complex, forms a complex called fluoride chloride. So through that, it now denies the body because now the body cannot utilize a compound. So such a kind of activities which I've just highlighted, I think there are 6 in number. There might be many, but that's the few I picked. They can lead now to somebody having bone and joint challenges. Now, having said that, what's the best way now to maintain our good health, bone and joint health? Sometimes people, when we do presentation, they ask, apart from the supplements, where can I get calcium? See, I go back to the sources of calcium. You can get almonds, you can eat. You can get broccoli, you can eat. You can get chia seeds, you can eat. You can get milk for the children, they can take, and other foodstuffs. Pumpkin has some, but it's not so much. And there are several others. But now, how do we in neolife? Now, when we come now to neolife, what's neolife? Then we ask now, why neolife? Why neolife? And now we find that neolife, being a nutritional company, has tried to avail, make it possible for one to get the calcium. Not only calcium, but I'm going to talk about calcium. I'm starting from now the muscles. I move down to some conditions now which develop if now one is not having enough calcium. Now, if the muscles are deprived of enough calcium, then we don't have efficient relaxation and contraction. And because of that, one develops muscle cramps. So, and if you find someone talking about muscle cramps, it means this person is having a challenge of calcium. So one of the major signs of calcium deficiency, the body tries to build its calcium. We have a way it builds, but if the building is slower than the depression, still we have the divisions. Now, muscle cramps are signs, are very good signs of calcium deficiency. And since now we don't take muscle cramps to the hospital and say, I'm having cramps, this person will go on with his or her normal life. If the man goes on drinking as normal, if the lady goes on activities as normal, and we end up now depleting the soft tissues. And one of the soft tissues which is depleted is the cartilage. What happens? The cartilage becomes thin. And once now it becomes thin, it may not necessarily be systematic in becoming thin. It may be asymptomatic, meaning it may be thin depending on where it's usually overstretched. If it's a teacher, mostly they will complain in the shoulder. They will complain that they are having pain in the shoulder. If it's somebody who walks in the joints, most on the knees, or if somebody who stands most of the time at the ankle, if somebody who sits in the office most of the time is in the lower backbone. So sometimes we may be having depression depending on where it's overstretched. Now, regardless where it's overstretched, overstretching is overstretching, and now we have someone developing pain. Because if it becomes thin, then it means now it's not able, the cartilage is not able to cushion the bones from inflammation. So one now starts developing inflammation. And that's now where we end up now, somebody now having painful joints, painful muscles, because now there's inflammation. Inflammation is just pain. It's pain. Tissues which are grinding against a tissue and providing pain. That's inflammation. Then what happens? Somebody may go for painkillers, as normal people do. And if you go for painkillers, yes, the pain, you will be relieved of the pain. But what happens next? The depression will continue. And now you find somebody now developing weak bones, a condition we call osteoporosis. Now, there's a backbone. And once the backbone is depleted and becomes thin, called spondylosis. Now, how do we manage these conditions then? For the one who thinks is not sick, the one who's not, or has not developed muscle cramps, the one who is active, he or she activities without any challenge, let the person take cardamom. Cardamom is one of the best products. And if you cannot get cardamom, you can combine multimineral with vegan D. It serves the same purpose. If you take multimineral with vegan D, it serves the same purpose. Now, for somebody now who already has developed painful joints, now you move to another level. It's not now preventing damage. The damage already has been done. Now, this is now where it becomes complex, because ladies, uterus, because of their physiological functions, uterus between 1200 to 1800 milligrams of calcium daily. And these milligrams are supposed to be supplied by diet. Then the question is, where are we getting enough? That's a question we ask. Are we getting enough from the diet? The answer is absolutely no. That's now where cardamom is going to be a constant product. But now for somebody who is already now damaged tissues, joints, backbone pain, this one you have to add now full motion to reconstruct the cartilage. Full motion is for the construction of the cartilage. Calcium is to prevent you from continuing withdrawing from the soft tissues. So you provide the body with a source as you give it a chance now to rebuild. But since now somebody is having inflammation, meaning this pain, to lubricate the tissues all over the body, that's where salmon oil plus comes in to provide anti-inflammatory index. Now I move ahead and I say, now, since now you created a hole, by withdrawing, you created a hole. But by taking calcium, you have not crossed the hole. That's why I had people multimineral. Why multimineral? As calcium provides for daily use, calcium to be available for daily use without touching the body. Where we withdrew it from, we need to reimburse it there so that we can again have the bone density back to normal. That's why we have extra minerals. So the multimineral provides that extra. And for your information, multimineral has a lot of calcium. One tablet of multimineral has a lot of calcium than one tablet of calcium. You can go and just do some calculation. So multimineral is for reimbursing the tissues, as calcium provides for the daily use. Full motion, yes, it doesn't have calcium, but it has some glucosamine, some zinc for regeneration and healing of the cartilage. And what does vegan D do? Vegan D adds to increased absorption. Vitamin and the minerals try to encourage one another in absorption. For those who are growing old, know that the body becomes weak, rejects minerals, doesn't want to absorb minerals so easily from the food or from wherever. So we try to force them in. Our karma is generated, meaning it's the way it's made, the absorption rate is high. But also we try to increase also the absorption rate by giving vegan D, which attracts more calcium to the bones and to the muscles. So magnesium takes care of, again, all the muscles. So you can interchange magnesium, you can change the vegan D. If it is karma, you can use magnesium, vegan D, and mineral, and you are good to go. But for somebody who is already having pain joints, then we are having full motion. You cannot do away with it without it. Salmon is a must, and now there are some cases where you need now to provide somebody with aloe vera plus. If somebody is having an acidic stomach and is having pain joints, the joints are having a challenge, whether muscle cramps, whether pain joints, whether arthritis, that person, we need to control the acid first, or else calcium will go to a waste. We'll give calcium, and calcium will be utilized to dilute the acid instead of being used in the muscles and in the bones. So ask a client, first of all, know whether the person is having acid. If the person is having high acid levels, aloe vera plus and zinc comes in handy, as they control the acid and the ulcers, and the other minerals now go hand in hand to take care of the joints and muscles. Now, it doesn't mean that one bottle of calcium, one bottle of salmon, or one program is enough. Depending on the severity of the case, some may repeat the program of around 5 to 6 products for 5 months, 4 months, some 3 months. So I'm not going to give you a guarantee that one is enough for somebody already who is having challenges. So talk to your client before you start a program. Advise them that one program may never be enough, because the depression may be higher. The bonds may be needing more than what the 1 month supply can supply. That's just a summary of it. Back to you, Fred.
Thank you so much, Riphath. Let me just adjust my phone here. So Riphath, maybe as we come to the end of the session, could you comment something about, because you've talked about osteoarthritis, but could you comment something about rheumatoid arthritis?
Yeah. Now, rheumatoid arthritis, I just, there's an oversight. Rheumatoid arthritis is now when we are having severe inflammation in the joints, and now the joints develop an infection. Are you getting clear?
Yes, I am.
Are you getting clear?
Yes, I am.
Joints. And now this infection brings out, any infection, you see now, it's like there's a wound in the joints. And this wound, attracts bacteria. And that's where now the swelling comes in, or some develop some watery substances in the joints. That's where you have to combine now garlic. Garlic comes in as a natural antibiotic. But you see, when we talk about rheumatoid, it means there's an infection and there's a bacteria now in the joints.
Okay. So that means that we take the same program.
Same program. What you add now to rheumatoid arthritis is garlic.
Or you just add garlic to the program.
Yes.
So we said
to provide now
omega-3
to clean omega-3. Now, first of all, you see, threonine is a must for everybody.
Okay.
Threonine is a must.
Yes.
Then, those who are the muscle cramps, calcium is a must. That is, those who now have developed joint challenges without the rheumatism, full motion, salmon, and multimineral come in handy. Then now, somebody now with the acidic stomach, together with the joints, aloe vera and zinc, together you add it to the program. Now, somebody with the rheumatoid or rheumatoid arthritis, then you add garlic. That's how it goes out. So you have to understand your client.
Okay, then the other thing that I would ask is, when somebody has arthritis, which are some of the foods that they should avoid? Because I've had cases of people being asked to avoid certain foods by doctors that they might aggravate the arthritis that they have. What would you say about that?
Of course, somebody with arthritis, you avoid meat. You avoid acidic foods.
Acidic foods, like, for example, can you take fermented milk or not?
That's an acidic food, Fred. Sukuma wiki is acidic. Sukuma wiki is acidic. Tusker and the squares and spirits are acidic. And you see now, what happens with men when they take the wines and the ones, and they may not be having arthritis, but they may have gout, because now the acid level is going to be high. We call it uric acid, and it's going to consume a lot of calcium from the joints, and they will be having something like need loss. That's what we call now the uric acid. But if you take calcium, it's going to neutralize them. So avoid such a kind of foods which now consume a lot of calcium. They deplete calcium levels.
Okay, it's good you've mentioned about gout. Would the same program be relevant for gout, or can it work for gout, or is there something we need to add?
Same program that's affected joints and muscles. They are just this program I've just said is for those who are think they are healthy, those who are having any small challenge and even a bigger challenge.
Okay, fantastic.
There's no challenge, Fred.
Yes.
There's no challenge which, if taken care of, will not grow to be a chronic and need expensive intervention. Those mamas, if you go to Nairobi Orthopedic Center, I usually advise people, if you want to know the severity of lack of calcium, go to Nairobi Orthopedic Center. That's near Kenyatta, where there's a lot of surgery for bones. And you realize people in crutches, they might be one way or the other neglected, even around the accident victims. But these people, more so the old ladies and men, they might in one way or the other have neglected the issue about calcium. Our mamas could have worked very hard to provide for us while they were eating a lot of their bones. And now we are shouldering the burden of taking care of them because they cannot walk properly. Now, what happens with now? Some people may ask, what happens in the backbone? If in the backbone is the structure of the backbone is just another unique bone, but if it's eroded, then it means it's going to lose balance. And then if it loses balance, then chances are that it's going to land on a nerve. And if it lands on a nerve, it's going to have a nerve constriction. So somebody may be having a lower limb pain while the back is the source of that one. So let us just take care of the bones when we can, because there are some conditions which also need even surgery, which you can avoid.
Okay, that's okay. I'm getting comments here. People are very excited. They're happy about the information that you have shared about bone and joint health. And let me ask you, as far as calcium is concerned, because there is always an issue of how much is enough calcium for, let's say, a lady who is lactating or a man. What would you say? How many mgs would be enough for daily, so that to safeguard yourself, and if you're not getting enough, to supplement? I know a tablet of calcium, magnesium has about 100 milligrams, and you normally take 3. But what would you say is the RDA, the required daily allowance for calcium for, let's say, a lady and a man?
I say that one earlier that ladies require 900, not 900, 1200 to 1800 milligrams of calcium daily. So even if we give them 3, we have given them a third of what they require. But even a third brings a difference. But what we are saying is that we are, because the supplements have not come to replace food. But as I said, ladies require 1200 to 1800, meaning for a lactating lady will require more than somebody who sits in an office. I think like that. because now the suckling, the child is getting more from the that's why they require more. So at least 1200 is enough. I may contradict. Medical is broad and it's having so many contradictions, but believe you me, 1200 is enough. If you can get 1200 every day, you will never have those challenges. For men, 900 is enough. Why? Men, they are not, they are less active. They are less active. Let me say they are less active, physiologically that is, and they don't talk more. They just talk more, and the talking more also increases. just on the right note. But now men 900.
That's exciting. Ladies talk more, so they use more calcium and magnesium than men. So men have an advantage because they talk less. That's exciting. I know I'll share that with my wife, and I know I might get into a bit of trouble, but that's a very exciting one. So I think, Dr. We have really enjoyed the session, and we are truly happy. And I know many people have learned a lot from the session that you've given us about arthritis. And there's this problem that I get frequently about a slipped disc, What would you say about that? Could it be as a result of the same?
Pardon?
Slip disc.
In the
spine, the slip disc. You hear somebody has gotten a slip disc, and sometimes they are told they may have to undergo a surgery. Could it be as a result of the same?
That's what I'm talking about. Yeah, that's what I'm talking about. If there's erosion of the bone mass in the spine, then there are chances of that one happen. It may not be that it's only erosion which facilitates it to happen, but also it's one of the major contributing factors.
Okay. So yes. Then that means that then in a case of a slip disc, then it means that the person needs to go through the same program and be able to get back on track. Program. Okay. Maybe yes. Just to ask you a question, what would be the role of vitamin B complex in the program for bones?
Now, calcium is a very complex mineral. One of the things is that one of the things it does is soothing of the nerves. Soothing. So there are people also even who lack sleep because of low calcium levels. Because the nerves, they need nerves to be soothed. So calcium does so much. Now, in an event where we are having low calcium levels, then it affects the way the nerves transmit their information. Now that's where now vitamin B complex comes in to restore that harmony. Because vitamin B complex, one of the major things they do, they regenerate new nerve cells. And that's where you see somebody with a backbone, we also try to give vitamin B complex, because if there's a challenge in the backbone, then there are chances that now some nerves may die. And now vitamin B comes in handy now to regenerate new nerve cells and restore the nervous system. So when we give vitamin B complex, we are looking at the nerves, essentially, which has been affected by the low calcium levels. And now, this medical thing is just a unique thing. If you, for those who have seen a carving, a rope puncture. If you don't inflate the puncture or the wheel, what happens? You will have a flat tire. Flat tire will affect the tire. If you continue moving, it will affect the tire. The tire would, if you continue moving again, you will affect the limb. I see. But what was the major, what was, did the vehicle lack the limb? No, it lacked just some pressure. So lack of enough pressure led to the tire being affected, the limb being affected, and the car stalling. And I want us to put pressure as calcium. Lack of enough calcium will affect so many functions, physiological functions in the body. Now, if now the limb is affected, by giving pressure, trying to put pressure again, it will not work. You have to get the new tire, you have to get the new limb, and again now to put the pressure in. So it's just lack of one mineral can lead to so many other defects in the body. I may not be able to, in a position to talk about the defects, but roughly you can see from muscle cramp to thin cartilage to weak bones to spondylosis, all that one just because of lack of enough calcium. So let us keep the main thing. Are we having enough of calcium in our joints, in our bodies?
There's somebody is asking about severe pelvic pain. Severe pelvic pain. What could be the cause of that? Severe pelvic, around the pelvic region, severe pelvic pain. Could it be as a result of the same topic that you're discussing?
It's just erosion of the cartilage in that area, leading to, chances are that this the bones have, there's a constriction of a nerve there. There's a constriction of a nerve. And that's why now somebody's having a lot of pain, because nerves transmit pain.
Okay, so then the program is the same.
The program is the same, so that now the cartilage can be reconstructed in order now for to separate the bones or the pelvic to be okay, so that to release the nerve,
Okay, fantastic. So, okay, now then there's a question here, and this one I got from somebody else recently as well. What about a burning sensation on the feet? Burning sensation, where you feel like your feet are on fire. Your limbs, basically, you feel like they are on fire. What could that be? A burning sensation.
Two conditions can lead to that one. If somebody is not having diabetes, then it's a severe lack of enough calcium, basically like that. See now, when the nerves are moving down, there's nothing to suit it. Ni kama radiator ambayo haina maji to cool the engine. So you find that now the burning sensation is a sign of severe mineral density. Hakuna calcium ya kusuit hiyo. So the nerves are burning because zimekimbia, transmit all the information, zikifika huko chini, they are
Okay, so you've heard it there. Yeah, I can see Dr. has frozen. It's actually severe lack of calcium that actually causes the burning sensation. Personally, I've actually encountered that with many patients of rheumatoid arthritis. They register that kind of symptom whereby they have limbs which are on fire, where you feel like the feet are burning and the limbs are actually burning. And when you take the program that he has mentioned, that is the TNN, omega-3, calcium, garlic helium, then you find that the burning sensation actually disappears. And one thing that happens is that any kind of pain that you might feel in your body or burning sensation, just know that you have a lot of inflammation going on in the body. And inflammation will actually give you that painful sensation that comes in your limbs and in your body. So when you take the program, as he has suggested it, 3NN, omega-3. Omega-3, if you take omega-3 for 60 days, 3 tablets a day, the big omega-3, then you lower inflammation by 68%. So that means that your inflammation goes down, the pain disappears. The omega-3 and the garlic allium is also able to fix your immunity. So in the case where the immunity is fighting the body, the limbs, the joints, then that one can be sorted out by that program. So that should be able to sort out the issue of a burning sensation. Now I see the Terry has fallen off, unfortunately, but I believe he had given us quite a bit as far as bone and joint health are concerned. I can see we still have more questions. Lydia, I see you also had a question. But what you can do, if you have any question, just talk to your upline. Just talk to your sponsor. What causes the pain on the ribs and how can it be sorted? Like I said, any kind of pain that you may be feeling in your body is as a result of inflammation. So what you need are things that will lower inflammation in your body. And 3NN, omega-3, calcium, garlic allium will actually lower inflammation in your body. Full motion will also be able to do that for you. And like Dr. said, even vitamin B complex comes in case the inflammation or the erosion of calcium has led to a nerve which is pinched, a nerve that is caught up and it's sending painful signals. When you take vitamin B complex with that program, then you're able to sort out the nerves in case it has to do with the nerves, and the pain will disappear. So just have that at the back of your mind. Anytime you have pain in your body, then you know there's inflammation in your body, and that can actually be able. Yes, I can see Damaris says, I had pain in the lower stomach, and she used omega-3, and those pains disappeared. Omega-3 will cure most of the pains in the body because omega-3 actually lowers inflammation in the body. Thank you, Damaris, for that. And you can see she had pains in the lower belly. You would not have thought that such pain would disappear with omega-3, but there you are. She took omega-3 and the pain disappeared. So omega-3 is just amazing. It's one of those products that you really, really need to take together with, of course, with the rest that he has talked about. So guys, we have come to the end of our session today. It was quite informative, and Dr. was able to field several questions, and we truly appreciate for that. Next week, we'll be back again, and we'll be discussing a different aspect of health. So I welcome you back, and I ask you to come with a friend next week so that we can be able to touch many people's lives. If you're here and you are a guest and you're looking at this for the first time, you're on this platform for the first time, you can get these products from the person who invited you, or you can join the company and become a distributor and buy the products direct, and also get to help other people who have health challenges, basically sort out their issues. And when you help other people sort out their issues, you also get to make money because these are part-time side hustles that you can do. And if you want to know more about the business side of things, how to make money from Neolife, tomorrow at 8 o'clock, our leader Pascal will be on this same platform, this same link, and we'll be talking about how to make money in Neolife. So you are welcome to come, and you are welcome to invite a friend or two tomorrow in the evening so that they can be able to learn more on how they can be able to make money. Kenyans are complaining about two things. They are complaining about health of the body, and they're complaining about the health of the pocket. So we have a solution for both. So make sure you invite as many friends as possible tomorrow in the evening at 8 o'clock. Send them the Zoom link, tell them Zoom in there, come and see how you can be able to make some money in a very exciting side hustle. And as you make money, you get to travel the world and you get to experience a lot of exciting lifestyle with Neolife. So thank you so much. God bless you. This recording will be available a little bit later today so that you can listen to it again and also share it with a friend. So thank you all. God bless you and good evening.